In our summit rounds this morning, we talked about getting surgeries authorized with the insurance companies. And there's a couple of things I thought would be really valuable to highlight from that discussion. One of the most common reasons that cases are not getting authorized is because the patients have not done physical therapy. And what's meant by that is that the insurance companies want to see typically 4 or more sessions of physical therapy that have been done for the problem that surgery is being performed for recently, like within the last 6 months or 12 months. Sometimes patients will be dealing with a long-standing problem that they've done physical therapy for over the years. Maybe they last did physical therapy 18 months ago, and we think it's now time for surgery. Well, the insurance company comes back and says, well, they haven't done recent physical therapy. It can be a little bit frustrating. We work with a lot of great physical therapists in the community, and I think one of the highlights of the discussion is that while it might be a little bit of a hoop for the patients to go through to get to surgery, there's a lot of value in working with physical therapy in the perioperative period, especially before surgery. So perhaps surgery is still going to be done and physical therapy is not going to prevent the need for surgery. But there's also some advantages to working with physical therapy, specifically the mechanics of movement, reminders and education on posture, some demonstration and work on specific exercises that would be relevant to healing after surgery, etc. So if you're in a situation where you're having trouble getting an insurance authorization for surgery and are told, you know, you really have to get more physical therapy so that insurance will authorize the surgery, I think that it is what it is. It doesn't mean that we're trying to push things down the road ourselves. I think it means it's just the reality of working with the insurance companies. And yet it is an opportunity to involve the therapist more in the perioperative period and to perhaps prevent a surgery or two, but also to improve the overall outcome of the operation, given that the patient's been working with physical therapy in the time recently preceding surgery and is geared and ready as much as possible for the operation and for the post-operative healing.